I've always known that I wanted to do something in healthcare, but not quite sure what. I was open to home health and I knew what home health was about, but I didn't imagine I'd love it as much as I do.
I joined Atrium in 2004. I've been in bedside nursing for like 14, 15 years. I was at crossroads and I feel like I need to make a change.
I have worked in a hospital setting in the past, but my main work has been in the home health.
I started working at Atrium Health at Home in 2004. Then I moved up in 2020 to the clinical operations manager.
I went back to school to become a nurse and started out in the cardiac field.
I have worked in a hospital setting. I've worked in a family doctor's office.
I joined Atrium Health at Home in 2022. Prior to that, I was an operating room nurse.
I was working in a hospital. I wanted to try something new.
Of anything I've done, this is what I've enjoyed the most.
Before there were hospitals, there was home health. So we did not go to a hospital or a specific location to receive treatment or care. We received care and treatment in the home, and that's the birthplace of nursing.
Home health, you get to do lots of different skills, wound care. We do some lab draws, all kinds of different skills. It's not repetitive day after day.
It allows you to use all of your skill sets at any given time.
We're able to work with all the disciplines to provide a better outcome for our patients.
Just about every aspect of nursing you're going to see in home health, except you're just taking care of the person at home rather than the controlled hospital environment.
Atrium Health does everything possible for the patient.
I love the variety that I have with our patients. We see patients from all walks of life.
The best thing about being in the home is you are with the patient where they are. Like, they can't hide from their grocery store purchases, they can't hide from their fridge.
I do live in this area and my patients live in this area, so we have a lot in common. We share about, oh, that restaurant is good, this store is good, so it's great.
I like meeting them on their own terms and feel like the rapport building in the home is a little more intimate.
The patients are so welcoming, they're so grateful that I'm there, and they're just happy to be healthy and thriving in their environment.
The home health schedule is very flexible.
I felt more valued with Atrium Health. The pay is very competitive and I feel I'm very well compensated for what I do. I wouldn't want to work anywhere else.
I'm not punching a clock. I get to spend time with the patient.
I love the staff. They are my work family. Everyone has an important part to make us work as a whole.
We have the most comprehensive orientation program I've ever worked with as a nurse. We have a very detailed process that's been honed over years of experience.
I had such great training preparing to be independent.
I was paired with a great preceptor who has taught me everything I need to know about being in home health.
Atrium Health does offer Ed Assist programs. I'm going back to school to get my bachelor's degree of nursing, and they will reimburse for my tuition. It means a lot to have an employer that is willing to help you go back to school to reach your goals.
I'm glad I'm here because I can make a difference for my patients.
It's one of those positions where you might not really know what it is until you come right along with us. I think it's so rewarding, and all the things we've talked about make me want to keep going.
Now that I'm in home health, I don't think I would go back to any other setting. I love it that much.